Welcome to Ask Anonymous. It's our monthly segment where patients have written in questions and then we videotape me answering the questions and helping to maybe answer questions you might have. And if you have other questions, feel free to write them in afterwards. So Ella's going to kick us off with the first question.
Can deep acne scars be removed?
So deep acne scars can't be removed completely. However, they can be greatly improved. What we've had success with in the past couple of years is combining our microneedling radiofrequency device called 𝙳𝚎𝚘 with our helix laser, which is a laser that combines a 1570 nanometer laser and the CO2 laser. The 𝙳𝚎 device actually penetrates a little bit deeper and sets off a small pulse of a radio frequency which will heat the dermis where the scar has penetrated into and help that dermis and the scar remodel, softening it. And then the helix laser will attack it from a slightly more superficial standpoint and help bring that base of that scar a little bit more superficial. And that way the scar can really look a lot better over time. Now this will take multiple treatments of the 𝙳𝚎 and usually 1 or 2 treatments of the helix depending upon the depth or the severity of the scar tissue.
I had a facelift 6 months ago, but now I'm being recommended a temple lift. I don't understand why the crow's feet area appears more lax and my lines near the eyes seem deeper than before. Botox doesn't seem to help. Can you explain why this might be happening?
That's a hard question to answer because I don't know what you looked like prior to your facelift. At 6 months, you can still have a little bit of swelling and the tissue may not have settled. So that might sort of exacerbate the crow's feet or the lines. Also, it could be that those lines were there and now with your face and neck looking better, maybe you're focusing on it. So sometimes a temporal lift can help pull up the outside part of your brow and that will open up this area and make that a lot more soft as far as your lines go, opening up, showing your eyes a little bit more. Sometimes you'll need an endoscopic brow lift, which raises more of the brow to really put that back into position. A facelift does not attack those areas. A facelift really points or is directed toward the cheek, the lower jaw, and the neck area. So the temporal area and the brows are above that, and usually you have to do some type of a brow lift to correct that.
What treatments are available for dark circles under the eyes?
Well, that's a tough one, is because dark circles can be from a number of reasons. Sometimes, patients just have some coloration. Usually a darker skinned individual will have darker pigments under the eyelids. Sometimes as we're getting older, we get a little bit of hollowing. And now that it looks darker because now you have shadowing. So dermal fillers can help bring that, if you have some hollowing, bring that so it's a little bit more even, and then the light hits it better so you don't have as much darkening. Sometimes you can use a laser. We use a chrome laser that will go after and target pigments and help break the pigments up. So sometimes that can be of help. That's just a tough problem, and so we'd have to see you and kind of go over how long you've had it, what we think might be the cause of it, and kind of tackle it in those modalities.
You have a few questions here about the pricing for different procedures, a labiaplasty, a breast aug, and a blepharoplasty. Do you want to address about cost?
The problem with addressing cost is, unless you're really examined and we know that you're going to need, say, a breast augmentation, you don't need a lift. So do you need, something else done instead of a labiaplasty? So it's hard to just give out cold numbers. We have a patient care coordinator that meets with all of our patients and goes over all of the fees. So the patients will get a breakdown of surgeon's fees, OR and anesthesia fees, or if it's a procedure room fee. So all those numbers are broken down for you. So it's difficult just to stay off the top of my head what something will be, because you really need to be examined and a sort of a surgical plan formulated for you first.
Is it possible to have fat removed from the knees and calves? If so, can this type of surgery be done without general anesthesia? I've seen a doctor on TikTok perform it without putting the patient fully under.
In a quick yes, it can be done, and it can be done quite easily. So there are multiple ways of doing that. I caution patients, if you're using social media, that's fine, but you have to be cautious of how it's being done on social media because there's a lot of things that may not be discussed. So be careful with that. But with your question, we use two different modalities or two different possibilities to remove fat from anywhere on the body. But knees and calves can be done in my procedure room. We have a device called Lipo-AI, which is a laser lipo. Patients are given some mild oral sedation, and we have a device called Pronox, which mixes nitrous gas and oxygen, sort of like laughing gas that a dentist would give you. So the patients are very comfortable, and then we use the same tumescent solution for liposuction we would use in the operating room. So we use that device pretty regularly for about the last 2.5 years for smaller areas, mostly submental, arms, calves, knees. Those are typical areas that we do, so you're not undergoing general anesthesia for that. The other way of doing it is to go to an operating room. Sometimes you can do it under IV sedation and again, also general anesthesia. So those are some different ways of tackling some unwanted fat areas. But our Lipo-AI device, we've had good success with for the last 2.5 years and very comfortable doing those type of procedures here in the office.
If I schedule a free consultation, can I also schedule a treatment for the same day, or would I need to book a separate appointment for a later date?
Well, depending upon what you're having the consultation for. So typically in our aesthetics center, patients will come in and meet with one of our nurse injectors. And so yes, you can do the consultation, going over maybe dermal fillers, neurotoxins, lasers, things like that you might be interested in. And typically if it's dermal fillers and neurotoxins, that can be done on the same day. Now, as far as lasers, that might have to be scheduled for a later time, and obviously surgical procedures would have to be done at a later time. One of the questions that our patients have is that if I have moles or skin cancer or typical lesions that we're taking off that we can do under local anesthesia, typically those will have to have a different date for the surgery versus the consultation.
What is the difference between a quick lift and a facelift, and what are the costs of both?
The quick lift and the facelift are completely different. I don't recommend quick lifts. Those are done usually in an office setting, and it's usually just a very superficial, cursory type of a lift. It's mostly pulling the excess skin. But as patients age, it's not so much excess skin that's the problem, it's the tissue below the skin that becomes the problem. That's why we have deepening in the nasolabial folds, where that tissue that used to be on your cheek is now building up on the side of your mouth. Jowling is the same way, where you get the marionette lines, that fullness there. That's not just skin, that is really the tissue below the skin. A quick lift really doesn't address that very well. You have a quick lift will give you, maybe 6 to 8 months worth of lifting, but a facelift is really a 2-layered procedure. It will attack the tissue below the skin and also the excess skin. So I would tell you, depending upon what you really want to go after, the facelift is usually going to be the better way to go. The longevity of a facelift is generally somewhere between 8 and 10 years.
Do you offer mini facelifts? I'm looking for a small adjustment and have limited funds saved for procedures.
Again, it's one of those things that you really do need to be examined. Let's see where, what your skin, your soft tissue, what it's doing, where it's at, and see what your goals are. So there's also some misconception with what a mini lift is. Some people call a mini lift a neck lift. Some people call it just the face, just the interior part of the face and not the complete facelift. So depending upon what you mean by the term mini lift, yes, little things can be done, but if you have somebody in their 60s and they have both some aging in the face and the neck, then doing a neck lift or this part of the face without the neck is going to put you out of balance. So let's talk about that. The other thing is, if you really only have a small amount of tweaking, so to speak, that you want done or lifting, then some of that can be done with dermal fillers, some of it can be done with microneedling radiofrequency, some of it can be done with our Helix lasers. So it doesn't always have to be a surgical procedure. Sometimes minimally invasive or non-invasive modalities can work pretty well depending upon what your expectations are.
I have had breast implants for years and developed capsular contracture level 2 again. What bacteria could be responsible for this, and what antibiotic is typically prescribed?
It's mostly bacteria that lives on our skin. So a lot of it is Staphylococcus, Corynebacteria. Those are the two biggest ones. But it's usually just bacteria that lives on our skin, that's just part of our flora, and it's not causing any issues. However, when it gets kind of dragged into the area or the pocket during surgery, then it can form what we're calling a biofilm. That may or may not be the reason. There's really no evidence that that is always the cause of every type of contracture. And so we do our best to reprep the skin, really reduce that skin flora, so to reduce the amount of bacteria that might be introduced into the pocket at the time of surgery. So usually it's medications like Keflex, doxycycline, clindamycin. Those are usually antibiotics. I usually give patients about a 5-day course after any type of implant surgery to try to keep the bacterial load down. Different surgeons have different ways of doing it, but we all reprep the skin and are really careful with how we handle the implant. So if somebody comes in with especially a grade 2, which is the start of a contracture, then I usually start patients either on Keflex or clindamycin right away and see if that can stop it. And we've had good success with that.
What type of procedure is best for reducing crow's feet?
Depending upon where the crow's feet are, that's a great question. So typically, crow's feet, when we smile, are on the lower part of the eye. A lot of times neurotoxins are the best way to treat that. We can just put a couple of units in, and that will just soften that area so that you don't have as much as a strong smile, and those lines can go away. When the lines are sort of on the side or above, that's usually a sign that, an aging sign where the brow is starting to come down and we get a little bit of crunching of the tissue over here. And in that case, then some type of a brow lift, whether it's a temporal brow lift or an endoscopic brow lift, can help open that. So if the crow's feet are above the corner of the eye, typically it's going to need a surgical intervention. If they're below, then a neurotoxin is still a good way to go.
And our last question, what's the most effective treatment for crepey under eye skin due to aging?
As of a couple years ago, I would have said, a lower lid surgery. But now we use our Helix laser, which again is the combination of a CO2 laser for resurfacing and also the 1570 nanometer laser, which can help shrink wrap the skin. So we've been using that successfully in the past year to, instead of going to surgery, treating somebody with the Helix laser and really tightening up that tissue. So it's not always about surgery anymore. Thank you for all your questions. I hope I did a good job answering them for you and clear them up. If you have any further questions, please feel free to email us or call in, and we will answer it at our next segment.